Good evening, I'm Chris Hensing, and this is the CBC Windsor News digital update. I want to start quickly here with a recap of some of the COVID-19 numbers, and that's because we have a breaking news situation at the Transit Windsor downtown terminal. We're going to get to our Dale Molnar, who's on the scene in just one moment, but to start, a quick update on what's happened here in Windsor, Essex County. There are now 141 confirmed cases of COVID-19, and that includes 3 deaths. 2 more seniors who are residents at the Country Village Homes long-term care facility have died. They were positive for COVID-19, tested before they passed. The results came in afterwards. 3 other residents at Country Village Homes have tested positive for COVID-19, along with 5 staff members. Amica at Windsor has 1 staff member that's tested positive for COVID-19 and a resident who is being treated in hospital. Lifetimes on Riverside has 1 staff and 1 resident. That's 3 outbreaks of COVID-19 at long-term care facilities in our region. Now, as I told you, we have a bit of breaking news tonight, so I'm going to go over here to our Dale Molnar. Dale Molnar has been following this Transit Windsor story. As you'll recall, the suspended service started on Monday, and that was a decision by Mayor Drew Dilkens. And you are now at the transit terminal. What can you tell us that's happening now, Dale?
Chris, there's a handful of Transit Windsor users here who are holding a bit of a sit-in and a protest about the suspension of the bus service. And they've been out here for about a half an hour to 45 minutes, drawing slogans and stuff like that with sidewalk chalk. We can take a look at some of this stuff. Now, the medical officer of health, Dr. Wajid Ahmed, is urging the mayor to reinstate the service. These folks are demanding that the mayor reinstate the service. They're also demanding that he apologize to everybody in LaSalle and Windsor and Tecumseh. Also, they want to, when they reinstate the service, they want to see protocols instituted to keep everyone safe. So that's about the size of it here right now. They're in total agreement that this is an essential service. You can see that they've written some of the things like that down here at this point, and they're in total agreement with Andrea Horvat, who is also calling on the province to help municipalities in this tough time keep bus services going. Chris?
Thanks, Dale. CBC's Dale Molnar live tonight as we see a protest, a sit-in at the downtown Windsor Transit Terminal. Okay, now as we say goodbye to Dale, we do have the head of Windsor Regional's Hospital on the line here. I'm just going to pull him up through Zoom. This has been something that we've been watching closely here as well. How the hospital is prepared and preparing during all of this. So we have David here now. Sorry to bring you out of the blue here, David, but again, important times and important conversations. How are you feeling today, just to start? I know that there's a lot of things going on. You feeling well?
Personally fine, beyond proud of our team, needless to say, and it's going to be a tough few weeks ahead of us, but we're in a good position, I guess I would say, and we're ready. I know the team's ready for the challenge and is there for our community.
About 2 weeks ago, I believe, me and you were chatting. It was a Friday just like this, and you talked about how we were in the calm before the storm. Where are we today?
Well, we're definitely at the start of the storm. We have a group of patients in our hospital that are very sick, who have been admitted, either tested positive for COVID and or we're waiting for the results, but they have all the symptoms of COVID. And what we've seen over the last 3 days out of our assessment center is increased volumes, but also increased swabbing rates, meaning before we used to have 50-55% of the patients that came to the assessment center would qualify clinically for swabbing. The last 3 days it's up to 90%. So we are definitely entering the storm, and we have to be ready for it as a community.
We've seen some of the extreme measures that have taken place inside of the hospitals. We've seen the new isolation rooms that have been popping up, the different ways that you're turning hallways and extra rooms into places to treat patients. And today we also saw at St. Clair College a field hospital. Why the need to have that set up now?
we have to be prepared and we have to be in front of this, and that's what we've been planning for going back to even last fall. Our team did a tabletop exercise and the topic was getting ready for novel coronavirus. So as early as this January, when we heard China had just a few hundred cases, we clearly got ready as a team and are in a good position right now to handle what's in front of us. And again, our strategy all along, plan for the worst case scenario, pray for the best, and be ready for everything in between. And that's where we're at.
This morning we had a sobering update from the Windsor-Essex County Health Unit, and this afternoon from Ontario's lead medical professionals telling us about the projections. Now, depending on if we keep our social and physical distancing proper, we can bring those numbers down. But what are you seeing in the coming weeks as far as the amount of people that you'll be expecting to see with COVID-19 symptoms or needing hospital treatment?
It'll be in the hundreds that we'll start seeing. And the goal is, again, for everyone in the community to stay home, only go out if it's an emergency, even within your house, practice social distancing, but just protect yourself, protect your family, and protect your loved ones, but just stay home. That's the bottom line. And if the more we stay home, the more we practice social distancing, the more opportunity we have to keep that curve and move it towards flattening. Because otherwise, if we don't, the number of patients that need health care, and definitely critical health care, will be substantial. And it's going to be a big strain on the system. And not only in Windsor-Essex, but if there's a hot spot elsewhere in the province, we've prepared ourselves in the Windsor Regional Hospital to help out the rest of the province.
I was reading today, the Windsor Star, Ann Jarvis has been reporting on this, and she talked about the need for an impromptu morgue. I don't ask because I want the gory details, but how seriously are you preparing for mass deaths?
That is part of our pandemic plan and is part of pandemic planning, and I can tell you that was arranged over a month ago, a couple months ago. So that is part of our planning, unfortunately, and we have to be prepared that in effect 6 months of deaths will occur within 6 weeks. And we have to ensure that we take care of those patients that have passed in the best way we can and recognize that.
You had mentioned the idea of hotspots. Watching what Detroit is going through, have there been lessons that we've been able to learn from the tabletop exercise, but also how our partners across the border at Henry Ford, for example, have reacted to this?
Yes, definitely with strength. And again, that's why we prepare for the field hospital now. You saw in Detroit, it kind of was announced a little bit later in the game with respect to what they're facing with Cobo Arena, the old Cobo Hall. So we do that now and don't wait until we become overwhelmed, and hopefully we never have to open it up. That's the goal. But we're going to be prepared for it, and it'll be ready to take its first patient arguably next week, and hopefully we never have to take a patient.
I can understand there. We've also heard from the Ontario Nursing Association about a potential lack of supplies, that certain PPE could run out within 5 days for hospitals within southwestern Ontario. From your understanding, how much personal protection equipment does the Windsor Regional Hospital System have on hand for those on the front lines?
Yeah, I don't know exactly where that's coming from. I mean, we have prepared since SARS with respect to pandemic planning and have always had a pandemic stock. So to raise those types of issues at this moment is not appropriate in my opinion, and it's not based upon fact. That's not to say that we're concerned about PPE and concerned about the continued what they call burn rate of PPE as we go forward. I can tell you we are actively working on a day-to-day basis on replenishing our PPE and also looking at a bigger plan. And we have individuals that are on the ground in foreign countries. And I can tell you, I spent a few hours today working through that and working with our federal government. Our MPP, Eric, has been amazing. He returns, we're on the phone multiple times a day, and he has got us letters that we need in order to acquire necessary PPE, put me in contact with ministers, deputy ministers, who immediately call and are working very hard on trying to help facilitate that for us, not only across Canada, but our Windsor Regional Hospital and take the time. So we have a gem, that MP, and he's been very helpful. So it's all hands on deck. Everyone's trying to work to protect not only Windsor, Essex, but Ontario and Canada for that matter, and we're part of it.
When we think of the people who are on the front lines who need that personal protective equipment, how do you feel they're reacting to the situation? When we see the posts and hear about how draining their days might be, what's the mood like when you interact with them?
It's tough. I mean, we have to remember they're people too. They have families. They have their own stresses in their own life. They have their partner that might have lost his or her job. So it's difficult, and they're not only dealing with community and recognize the responsibility they have right now taking care of patients, but also their own personal life. But I just got an email tonight from a nurse that I shared. She agreed I could share it with the team, and she was taking care of a COVID positive patient, and that patient asked the nurse about her own children. And this patient's not doing well, but I kept asking her about her own children by name. And it's just touching that she had such an experience with a patient, and this patient is going through a very difficult time, and this patient's worrying about her as a nurse. So those are the stories.
That human connection there, it's something that came up earlier this week. You had sent us a statement, an email, after there was some criticism of the American, the people who work in Detroit but live in Windsor, Essex, the nurses specifically, the healthcare staff. What have you seen as it relates to the border, and are you concerned about the medical staff that might still be crossing?
I'm concerned that they're doing a job. And there's thousands of them going across on a daily basis, taking care of patients that need them. And I expect them as professionals when they come home to be in self-isolation and protect themselves and their families. Our healthcare workers who are going across to the States and even here, going to be infected with COVID, yes, we are no different than the community. We have to recognize that there is going to be community spread, and healthcare workers are going to get it, and they are going to get it possibly when they're at work if there's a breach of PPE, and they do their best to protect themselves. But also when they go home, going into self-isolation and taking care of themselves. We had great donors donating hotel space for our staff to be in locally. Those that are concerned about going home, they have an opportunity to be in a hotel. It's a tough decision because they're away from their family while they're there, totally away. They can't go visit their family, and they can't have their family visit them. But some of them who are very concerned because they live with their elderly parents and or have an immune compromised child have agreed to do that, have decided to do that. And we're supporting them as best we can, and with the community support with Mr. Fari and his hotel, and also WFC who paying for it. So it's a difficult time. Some difficult decisions have to be made, but I can't be prouder of our team and what they're doing and what they're going through personally.
We've seen the chalk art, we've seen the signs in the windows, and we've heard the rattling. Is that getting to the people at Windsor Regional Hospital? Are they seeing that too?
Oh, for sure. For sure. They recognize it and they appreciate it. They appreciate the Windsor Essex community, the outpouring of support, of love for them. And they recognize that the community, this is the time for them as healthcare workers that they went to school for, that they were educated for, that they trained for, that they worked for, that we did all the tabletops for. This is when the community needs us. And to have the community rally around them and support them gives them the strength to show up to work every day and deal with these issues that they're facing. It's difficult. And if anyone thinks that this is low risk or that this is not in front of us and that this is all blown out of proportion, please, it's not. We have some very sick individuals and they're not all at the high risk categories. We got 40-year-olds, we got 50-year-olds in critical care right now with this. And it can affect anybody. So please, even if you feel yourself, you're healthy and you get it, going to be nothing more than a cold. If you get it, you can be asymptomatic for a period of time and you can pass it to somebody else who's not going to be as lucky as you. So please stay home. Don't go out unless it's an emergency situation, and do the social distancing. Make sure you do proper hand hygiene. Just protect yourself, protect your family, protect the community. This is not something to say, oh, this is nothing more than influenza. Well, folks, it is. And we have to all do this together, and that's behind me with Together We Stay Strong. All those colors behind me are from Windsor Regional Hotel, New Grace Healthcare, and Erie Shores, and this is our tagline at the hospital. And we handed out scrubs to every single employee with it on their heart, is to say this is what we're here for, and our community's looking to us to lead, and I can't be proud of our team doing that.
Strong message. Thank you again for your time. I can understand you're busy, and best of luck in the weeks ahead.
Take care, Chris, and stay strong and stay safe.
Thank you. So as you heard there, a strong call to action for people in our community in a way that you'd be able to help those on the front lines. You heard him talking about personal protection equipment and that he believes that there is enough at this time and they're continuing to try and find more. You also heard him talk about how serious this is, the idea of looking to find a temporary morgue. The other thing that stood out for me there, the idea we're going to have in Windsor, Essex, potentially 6 months worth of deaths in a 6-week period time. We heard more about that today from the province and the Windsor Essex County Health Unit. The province saying that COVID-19, according to their projections, with the most recent data, could kill 3,000 to 15,000 people in Ontario. That's what their models show. Now that could be something that we deal with for up to 18 months to 2 years. And when we look at what's happening locally this morning, the Windsor Essex County Health Unit broke that down as well. And they said that if we follow all these physical distancing measures, that we have a chance to flatten that curve. But if we don't follow that, if we operate on a baseline where we're not following the rules that have been sent out from public health officials, we could be looking at 200,000 cases of COVID-19 and 4,000 deaths in our community, in Windsor, Essex alone. But again, to stress the point, the doctor in charge of Windsor Essex County Health Unit, Dr. Ahmed, says that 95% of that can be cut back if there are those proper safe distancing measures that have been put in place. And we also saw today from the province a change in the number of essential businesses that are allowed to open. We have the full details there on our website, cbc.ca/Windsor. And another thing that we saw as well today is changes in what people are able to do with their free time as of now, and hearing more about what that means. I'm just going to pull up our Jacob Barker. Now, Jacob has been out in the field working on a story about specifically what it's like for people who are usually out fishing. Now, I know that it might sound trivial to those who don't use that as an active recreational pursuit, but for some people, we've heard that this is a way of life. This is what they enjoy doing, and it's also a business venture as well, something that people need to make sure that they have food for families, money, cash, to be able to support each other during this pandemic. pandemic. So I'm just going to pull up our Jacob Barker here now, who has been looking into this for us. And again, as we wait for Jacob to answer the call, another reminder here that we have on our Windsor Morning Show, the daily updates, the news that you need to know about what's happening in our community. Every morning we've been listening and hearing from our mayor as well, Mayor Drew Dilkins, who's been giving updates. And as you heard Dale Molnar tell us earlier, there is a call from the community for him to reverse the decision for Transit Windsor. He said at the time that decision to suspend services was made because he needed to protect the lives of people who may be on that bus. Some others feel that it also blocks them from being able to go to essential services, to be able to provide the services that we need as our community. Now, Jacob, I just brought you up here, and I apologize for the delay here for our folks there watching at home, but we find you on the river. What are you looking into today specifically?
Yeah, I did want to draw your attention here to this sign. These have gone up at port facility, docks and at boat launches around the province, and here in Windsor City. The province has decided to close down these types of like boat launches and ways for people to get into the water. And it was part of the announcement about amenities the other day. It wasn't mentioned specifically, but they have closed them, and it is not being welcomed by people who use the water frequently. It's something that impacts the community. This is a very busy time of year for the fishing community. It's right when the walleye start running into the river, and often, people who do run services on the river have a lot of customers and clients that come at this time of year. Obviously, because the border is closed, that's not happening. But it also stops anybody from going out on the river who want to. And this is something that people want to do and want to be able to do. I spoke with one worker who was laid off by Chrysler, and he said that he, would be out on the river right now if these weren't in place. And if you look just beside us, there's a park, and people are allowed to walk, of course, keeping social distancing in mind. But if you're out on the river, you're away from people, and it's a way to get away from the mainland and sort of relieve stress and things like that. So it is something that people are not welcoming and think that could be revisited by the province. I do know in Chatham-Kent, those boat launches have been left open, but they're not sure if they're going to be leaving them open. That's something that they're looking to the province right now to decide what to do.
It's interesting, Jacob. Even as we're talking to you now, I can't tell if that's a boat on the water, but we're right on the water here at CBC, and we see them still going out and about. Where would those boats be coming from your guess?
Well, from what I understand, the rules across the water in Michigan are different, and as we know, things are being impacted. The situation on the other side of the water is not a good one right now. But the rules when it comes to launching your boats is different. They have closed parks like they did here. They have closed marinas and things like that. But when it comes to boat launches, they are still letting people get out on the water.
Okay. And you had been in touch with the province on this as well, and they responded to you about marinas specifically?
Well, they talked about boat launches. I said, you know what? I mean, it wasn't mentioned specifically as one of the amenities to be closed, but it was mentioned. But in that release, it did say that, other things that aren't mentioned here are subject to closures, and that goes for both public and private facilities. Should be closed right now, and people really shouldn't be thinking about launching their boat right now. A spokesperson said they should be thinking about staying home and getting that curve flattened.
That's exactly it. Thanks for this, Jacob.
Yeah, thanks, Chris.
CBC's Jacob Barker there, right on the river, as you can see. Another one of those instances where we're seeing some discrepancies. What happens in one community isn't happening in another community, but you can hear there, as Jacob's reporting reflects, there's a desire for everybody to sort of be on the same page, not just for the residents who live in this area, but also for the officials as well. The other thing that we've noticed is a call for action on those people who are not self-isolating. We've seen that the Quarantine Act has been put in place. We've gotten a number of reports from people who are just calling our office, tagging us on Facebook, sending tweets, emails, everything, about how they know people who have done international travel but aren't self-isolating, aren't taking that quarantine seriously. Now, we have a full story on that on our website, cbc.ca/Windsor, and it will describe what authorities can do and what you can do as you try and make sure that your community members are safe. Now, this show has been a little bit different for the last little bit. I can say that as of Monday, we will be back on our normal time slot. That's 6 p.m. We'll be on your television stations as well. And the digital show that we're doing here will continue, but it will start at 6 o'clock. Now, as far as everything else, well, we always have you updated on our website, cbc.ca/Windsor. That's where we'll be over the weekend here. As you heard from the head of Windsor Regional Hospital, we are expecting a surge, saying that 2 weeks ago we were in the calm before the storm, but it's starting to hit us now. Stay safe, wash your hands, and look after each other this weekend. Thanks for watching.